New at 5, Indiana reports its lowest hospitalizations in 7 months. Now, new data from the State Department of Health show 58 fewer Hoosiers are hospitalized with the virus compared to what we've seen even yesterday. The last time that Indiana saw numbers this low was August 6th with 1,115.
All right, and that brings us to our health spotlight tonight, and we welcome in WISH TV medical expert and former Surgeon General, Dr. Jerome Adams. Doctor, good to see you as always. Thank you for coming in studio, by the way.
Well, great to be with you, and that's yet another sign that things are moving in the right direction.
Absolutely.
We're able to be back in studio.
As you know, the CDC meeting tomorrow to discuss new COVID guidance. Reports indicate that the White House might be changing some things up, maybe even some say throwing in the towel. Your thoughts on what could happen tomorrow?
Well, I absolutely don't think they're throwing in the towel. I've been talking to my sources still in government, and what they're telling me is they're trying to give communities real evidence-based ways to determine when should we start relaxing mitigation measures. And that's what I've always said to you. I said, look, we need to move forward. If we're doing the right things and the numbers are moving in the right direction, we can take our foot off the gas a little bit. If we're going in the wrong direction, we need to put our foot on the brakes a little bit. And the good news is Indiana's going in the right direction. We're not quite where I think the CDC is going to say we ultimately should be, but many places around the state are going in the right direction.
And we'll get to the numbers in a moment here, and I know we just talked about them a little while ago as well. You made a really good analogy the last time you were on with us, at least with me. I think you said it was 115 miles an hour, you get pulled over.
Exactly.
You tell the cop, hey, I was going 115, but now I'm going 90, right? So
Exactly.
It was still over the speed limit. Where are we right now, in your opinion?
Well, in my opinion, we are moving in the right direction. Cases are about 1/10 of what they were a month ago.
Right.
So good on Hoosiers for that. One of the things, and I think you'll show this in the numbers, is that our vaccination rates and our booster rates are still nowhere near even national averages, which don't even come close to other countries. So we're still in trouble for future surges if they come our way. And that's why every time I come on here, I say, get your vaccine, get your booster, or at least talk to your doctor so you can make an informed choice. But numbers, hospitalizations, cases, and deaths, fortunately, going in the right direction, though far too high.
We have some work to do, but let's take a look at the numbers right now. We'll put them up on your screen. I think we have a graphic that we want to show you right now. There they are. Indiana's 7-day average for new cases, just under 1,200 right now. But 1 month ago, we had more than 12,500 cases in a day. The state also has a fully vaccinated rate, as you just mentioned, 56.5%, a booster rate of around 27%. So, as you just mentioned, not great. We still need some work to be done here, right? We still need to get shots. We still need to get booster shots.
Well, we do, and when I come on here, I don't want to be known as the bad guy. I want people to know that we're going in the right direction. And what I hear is that the CDC is going to look at our cases per 100,000. Those are going in the right direction as an initial gate. Then they're going to look at our hospitalizations. And you heard Alexis talk about how those are going in the right direction every single day. And then they're going to look at our hospital and ICU capacity, again, going in the right direction. So take heart that things are moving in the direction we want to. There are some places in the state that actually are in a good spot, which is why I love that dashboard that ISDH has, where you can see your county. But some counties, they've got a lot of work to do. It's going to be on us to create the conditions where we can safely reopen, particularly for kids under 5 who still can't get vaccinated.
I have about a minute left, so I want to get your take on this one because I know two stories caught your eye this week. One, a decrease in cancer screenings because of the pandemic, and an increase in maternal mortality during the pandemic.
Well, one thing we've seen is that other care besides COVID care has been delayed or deferred during this pandemic, and that's actually starting to harm people, particularly people of color. We know black women are much more likely to die during childbirth compared to other individuals. And so what I would say to folks is now's the time to make that appointment with your doctor. Get your mammogram, get your colonoscopy. If you're pregnant, please talk to your doctor. We want it to be safer for people to come back in the office physically, but also mentally. We want them to feel like they can go in and get that care. Otherwise, more people are going to die from non-COVID related causes than have died from COVID.
Doc, good to have you in studio. Always good to see you, sir.
Good. Drive safely out there, people.
Me too.
There are many things out there that can get you besides COVID. We don't want the roads to be one of them.
That's right. Dr. Adams, always good to see you. Thank you.